While nations encourage their populations to stay inside, healthcare providers are more active than ever in response to the outbreak of the novel coronavirus. Healthcare leaders across the country are in pure survival mode. It's hard to think beyond the next few weeks as we scramble to adapt to the new world of COVID-19 and mitigate the impact on our hospitals and providers. There are 2,000 hospital beds scattered all over the country. Hospitals themselves serve around 1,400 patients daily. In the case of a pandemic, the number of people who need to be hospitalized increases exponentially, revealing a shortage of space and supplies. Kosovo needs a solution so that patients can consult with doctors without occupying space in the hospitals. With limited time to be outside, citizens need a safe and reliable way to access healthcare. Limited to just 8 hours, hospitals become crowded and unsafe. The number of cases is increasing, and the urgent need for a new system is all too clear. What if, by using technology, we can distribute resources where they're most needed? With technology, we could sort patients to facilities without endangering them or the medical professionals working in the front line. VecSchnosh is the app that bridges the gap between people, physicians, and health systems, enabling everyone, especially symptomatic patients, to stay at home and communicate with physicians through virtual channels, helping reduce the spread of the virus both in the general population as well as in medical staff. By harnessing the power of technology, we can distribute resources where they're most needed without being constrained by geographic location. VecSchnosh. Imagine two scenarios. In one, the patient can get a diagnosis from the comfort of her home. If the patient doesn't show symptoms of coronavirus, she can still be treated for other illnesses and maladies, saving both her time and the doctor's. If necessary, the doctor can provide a prescription that the patient can pick up at the nearest pharmacy. When she shows the symptoms of the virus, she is able to quickly and safely consult a medical professional for next steps without ever having to interact in person. In another scenario, however, the patient must take around 35 minutes to commute to the doctor's office, wait in a germ-ridden waiting room, and needlessly expose herself and others to infection. All in all, this application has many potential uses, including but not limited to the coronavirus pandemic. From broken bones to COVID-19, this application maximizes the potential of the current healthcare system and helps citizens of Kosovo get the medical care they need. Developing this app would help reduce the spread of coronavirus, but it would also help decrease unnecessary spending in the medical field and makes healthcare more accessible to all in terms of cost, efficiency, and quality. The possibilities of telemedicine are endless, and this application is a crucial first step in revolutionizing the way Kosovo approaches not only an unprecedented pandemic, but also healthcare as a whole.